and I hope people join early so we can start our question answer session. I hope yes, the last time's question answer session we had few questions not answered because of the time. So if you remember those questions, do ask so that we can complete those first. And of course, again I have few cases where I would like to tell you something about some remedies which had given me very good results in the last week, or in say where we left on last Saturday. So happy they've joined. Welcome, Dr. Meera. Now everybody knows the remedy sepia. Sepia is a very important polycrest, very commonly used. Everybody must have used sepia once in their life, and maybe in weekly you must be giving sepia. Now there are some symptoms of sepia that you have to understand in relation to mind. We had a very interesting case where the patient, of course, sepia is what you call is anarchist, revolutionary. One symptom of sepia that everybody should remember in their practice. So good afternoon, Dr. Meera, Dr. Gaurav. Yeah, good afternoon. Yes. So one symptom, of course, the one symptom of sepia that everybody should remember, that is a sepia patient cannot demonstrate affections. Remember this. अगर आप किसी से प्यार करते हैं, आप किसी कोई चीज़ पसंद है आपको, कोई पसंद है आपको, और आप बोल ही नहीं सकते, मतलब आपको लगता है मैं कैसे बोलूँ, हाउ डू आई स्पीक, मैं कैसे बोलूँ, और वो आदमी रुकता है और वो आदमी को लगता है ये तो मेरे से प्यार ही नहीं करती मेरे को. बट द अपोजिट इज देयर. अ sepia patient cannot demonstrate the affection. It is not only because that what you say, it is not only that in relation to love, it can be in relation to anything. You like a person, you like his shirt, you like his dress, you like his face, you like him as a personality. That a sepia patient cannot demonstrate. And the very important symptom of sepia, that is cannot demonstrate affection, and one symptom rejects affection. Both are symptoms of sepia. Very, very important symptom. In fact, the core symptom you must understand, that is sepia. Cannot demonstrate and rejects affection. So this is also very important in sepia. One more symptom of sepia, very, very important, is that fear that something will happen to him or to the family. Like it is said that in sepia, it is said that the patient feels as if the husband will not return home. The husband will not return home. Now it is not only sepia, but sepia, remember, sepia has a very important fear that something will happen to family. Because you know what happens? Whenever the word family comes, we always think about the family remedies, the calcareas and all. But don't forget sepia. Of course, calcarea carb is there, calcarea sulf is there, phosphorus is there, but sepia is also there. So good afternoon, Dr. Babel, Dr. Aurora, Dr. Paul. So what I was telling you, fear that something will happen to the family, a very important remedy. And I had a very interesting case of, I'll discuss sepia, and I'll make you understand what and how did I interpret the rubric. I had a case where the patient was telling me that I am so dependent on my father, my mother, my friends, my relatives. It is not that I am dependent for money, XYZ, but I feel that these are my pillars, these are my strengths, and I always fear. Can we have some silence here? Can we have some silence? So, sorry, there was a bit noise, there were some students talking here. So the patient felt that I am so dependent on my father, mother, friends. It is not that I always want them, but they are my pillars of strength. And whenever that happens, something wrong happens to them, I feel depressed, I feel sad, I feel what will happen of me. Of course, we took the rubric that fear something would happen, but the most important thing which I took is fear that joints are weak. Can you close the fan? The voice is disturbing. Fear that joints are weak. The same fan. Fear that the joints are weak. And that's why if you go to the repertory, in the mind chapter we have fear joints are weak. It is not that because the basic joints are weak. You always have that fear that something will happen to persons who we rely on. So we took that rubric, fear joints are weak, and I prescribed the patient CPR 1 m single dose, which cured the case. I hope you understood this rubric. Anybody? Fear joints are weak. Dr. Bhumika Bhatt, welcome. Dr. Sangma, welcome. Dr. 911, okay. Could you understand this rubric? Fear joints are weak. Anybody? If you think you understood, just give me a thumbs up. And in Instagram, though there's no thumbs up, you can give some hearts, so that I feel that you understood that. Understand this rubric, that fear joints are weak. So reliable part, because see, otherwise what will happen, you can never be able to take this rubric. And if you'll be surprised, that this rubric is present in CPR, only one remedy has it, and that is CPR. And that's why CPR is so important to understand, and these type of rubrics are very, very important to interpret. That is very important. Yeah, now we are not talking about actual weak joints, Dr. Babal. I am talking mine. Fear that joints are weak. Can you understand that? Can you understand that? The fear that joints are weak. Some fan voice is there, but I can hear some voice. It's disturbing. Fear that joints, family bonding is weak. It is not family. Just I told you, it's not family bonding. It is basically what we say, not family bonding. The persons on whom you rely, the persons on whom you trust, the persons who are the pillars of strength for you, and suddenly something happens to them and you feel, oh my god, what will happen to me? And then that fear starts. It is not only regarding family. That's why I told you, whenever the word family comes, we think about the calcare self and other remedies. But don't miss CPR. I hope you understood, and everybody, because it's a very, very important rubric. When I teach my students here, and they are also surprised that, sir, how can you interpret this? It did not come to me in one day or 1 year or years. It came to me after so many 20 years, 25 years of practice. So this is very important. Good afternoon, Dr. Navjot. Sir, I have a patient who is very close to CPI in mental and other symptoms, but she is sexually active. When I asked about it, can I still go ahead and think of other remedies? Yeah. See, don't rule out the remedy just because one symptom is missing or two symptoms are missing. That is not important. See, every remedy has three phases: the soric phase, the psychotic phase, and the syphilitic phase. So if you feel first understand which phase the patient has come to you with the disease, and then match that symptom. For example, if the patient has come to you with a syphilitic symptom of cancer or destruction, then match that syphilitic symptoms of that patient. Don't go with the soric symptom, because you can't match all the symptoms of the remedy. So depends on the miasm and in which phase the patient has come to you. That is very important. So I hope you understood that. Second thing, one thing is very important for CPR also. A CPR patient is easy to magnetize. On the contrary, when we thought that CPR is very strong, does not like anybody, indifferent, in soric phase CPR has easy to magnetize, and you'll be surprised, easy to be magnetized. CPR is there, and surprisingly, which remedy is there? Lachesis is there, and causticum is also there. So these are the phases of remedies that you should understand, so that you don't rule out the remedy just because of one symptom. You can definitely give that. Okay, so we have this question answered. Any other symptoms, or we can basically start more about CPR mind. Yes, so there's no question. There was some question on basically Skype and WhatsApp. I just forgot to get. If you have that, you can always ask me. One thing also is very important in CPR. A CPR patient, which miasm come from CPR? See, all the three miasms. CPR has symptoms of anxiety, CPR has symptoms of psychosis, and CPR has symptoms of syphilis. It covers all the three miasms. You have to pick those symptoms of CPR, which is soric, which is psychotic, which is syphilitic. So every remedy has most of the polycrest have all the three phases. Yes, one more symptom of CPR which is very important. A CPR patient feels well before falling ill. Can anybody understand this symptom? CPR patient feels well before falling sick. Of course, it is written in Soranum, feels happy or feels well one day before a sickness. That is Soranum. But sepia, a patient feels well before falling sick. Can anybody understand or make me understand what is the meaning of this? A sepia patient feels ill before sepia patient feels very ill before falling sick. CPI is there, Soranum is there, a lot of other remedies are there. Yes, Soranum is there. So these are the very important symptoms of mind which I wanted to share today in CPI. Of course, your case taking has to be good. If your case taking is good and you are able to what you call see few symptoms of CPI and understand the patient's language and interpret that in your practice, it would be better. Just before I close CPI mind, remember CPI has one more very important symptom. I had a case where a housewife came to me and told me, sir, now I am tired of life. I have done everything for my family. I have done for my husband, my children, my father-in-law, my mother-in-law, for society. Now I cannot handle anything more. I have just stopped doing everything. I have just stopped doing everything. You can take indifference and still CPI would come. But there's a very interesting symptom in CPI. Handle things cannot anymore, especially housewives. CPI is a very important remedy. In fact, there are only two remedies for that. First is CPI and the second is bambuza. The second is bambuza. I hope you understand the symptom. I hope you understand the symptom. Bambuza and sepia. And don't tell me that every second patient comes to you as a housewife and she is 45-50 years of age after menopause and she tells the same symptom. Don't give everybody sepia. Try to evaluate the symptom. Okay, bambuza, BAMBUSA, barabar. So phosphorus is there. In what symptom I didn't understand. Sir, which miasm comes from? Every miasm, all the three miasm. Okay. Amusement, lack of sepia. Okay, it's there. It is there. Oh, sorry, one questions from Instagram. I would like to thank you for your case on OM. Patient had right ear otitis mid 23 years. Just by giving single dose of aurum metallicum tonic, patient is absolutely fine. Pain completely stopped. Discharge reduced to 80%. Very good. Congratulations, Dr. Meera, and very well said. Very well, a good case. Okay, very well, and thank you for sharing your case. CPI is a polycrest remedy. Yes, amusement lack of also can be sepia. Thanks, sir, to open comment box. Okay, thank you. Actually, whatever I'm there on social media, it's all because of my assistants and juniors who are with me. So I hardly know what to do, but they tell me, sir, you have to speak, so I go and speak there. So thank you. So Mukesh, good afternoon. Thank you. Gaurav saying thank you. Thank you. So I hope you understood. Welcome, Dr. Sonal. Okay. So this is sepia. It's a polycrest, but definitely I wanted to share some symptom that's why I took one of the this symptom to sepia to share. So do we have some more questions, or we can go some to another case or something more related to sepia? Sepia has one of the very important symptom. There is sir, please give your views on sepia for males. See, it is not always that when we tell that sepia is only a remedy of female, you think about female. It is mostly indicated because it improving it gave most symptom to female that on male. That's why we say that. But it's not only a male female remedy. It has a lot of other symptoms also, sepia. So don't just label it as a female remedy. But because sepia covers most of the symptom in relation to what you call menses, that's why it's more important female remedy. But still, if you want to know, there is a very important symptom of sepia. A sepia patient suffers from elements from masturbation. And one symptom of sepia which I have confirmed in so many cases in male genitalia. Please write down this symptom in your notes. Recurrent ulcers on the penis. You must think about sepia. Remember this, recurrent ulcers on the penis. Do think about sepia. A very important remedy. Sepia is only indicated and it is only one marking symptom, that the remedy is sepia. Very, very important. Second symptom of CPR in relation to male, if you want, itching of the penis. A case had come to me where he said, whenever I wake up in the morning, I first for 10-15 minutes I keep itching at the genitalia. I gave lot of remedies, I gave him silicia, I gave him rustox, I gave him nitric acid. And as we have that fixed mind that CPR is a female remedy, I opened the Mater Medica, and in comparison of nitric acid and petroleum, CPR was given. I gave CPR 200 and the itching vanished. Especially if the itching is on the glans penis, my dear friends, just give CPR, because I have told you. Two remedies very important, CPR and petroleum. So these are the very important clinical symptoms. I hope which doctor has asked me, Dr. Sangma, you get some inputs in that, left-sided patient mind very strong, can read mind of others, senses very acute, control very strong, expectation high, after hysterectomy, dryness of genitals with decreased sexuality, now absence of sexual desire, nodule in neck and left arm, after vaccination in left arm, now motion or syndrome left feet. See, whenever you are basically studying a case and you have a classical symptom that after a hysterectomy, so whatever I feel, whenever there is a symptom exactly after hysterectomy, that means the hormonal load of the patient is taken care of and is gone, and there is dryness, and there is loss of sexual, loss of desire, loss of libido. I told you before also, I had case of menses problem. The child did not have menses. The girl did not have menses for I think 1 year. Her voice was male type pattern. She had hirsutism, and I gave the remedy testosterone. So you can start the case with testosterone, and you open up the case with this remedy, and then with few symptom added, you can always take a case and then give a remedy. You can open the case with testosterone. Dr. Amzar Ali, welcome. I hope Dr. Nadia, you got some inputs on this in this, because patient mentally is very diligent, appears very sound, appears very good, appears very defined, but because of hysterectomy, dryness of the genitals, loss of libido, so it's the male hormone that is involved. So give testosterone, and with C, you must give testosterone. Normally, if you want to give testosterone, you can start with 200 potency in water dilution. Dr. Vaishnav, good afternoon. Dr. Sangma, okay, thank you. You try this, Dr. Nadia, and please get back to us so that we also know that the patient is better. These are all my clinical secrets of practice which I am sharing with you. Very, very interesting, because if I start giving Mater Medica for this symptom, there are a lot of remedies, but this is my clinical experience. Open up the case and you will get the symptom remedy. In fact, most of the cases, if you give testosterone, it will give good result. Otherwise, normally if the patient says that the female symptom starts coming, then you can start the case with a simple dose of estrogen or progesterone. Okay. So welcome, Dr. Misha. Some question might have scrolled up. So as you go further, I hope you understood something about male symptoms of CPR, Dr. Sangma. Very interesting question, but sometimes we are so prejudiced, that's why we label the remedy as male and female. So it's not like that. Of course, a lot of male and female symptoms are there, but these male symptoms which I have told you, very, very important. If you get a case of this type of case of penis, glans, penis itching, ulceration, you should be lucky that CPR will definitely work. In fact, I would like to go further once, that if you get a case and when there is eruption on the glans penis, see the patient, eruptions on the glans penis, that also is covered by CPR and petroleum. So this is a very, very important symptom. I had a case of venereal disease where after the impure coagulation, the male suffered from eruptions on the penis. He told me on the penis, but the remedy did not work. Then when I examined the case, it was exactly on the gland penis, and CPR cured the case. So this is the importance of being an unprejudiced observer, as Dr. Hahnemann has told us in aphorism number 6. I hope, Dr. Sangma, this helps you. Yeah, Dr. Clinical views are more important. Yes, Dr. Nadia will. That is what I want. I don't want to start my Google Meet, or I take lectures and seminars. In fact, we have seminars bi-monthly for foreign doctors, and I always tell them, just ask me what I have done clinically in my practice. Don't ask me what is written in books, because I might have not seen that in books, but clinically there are some remedies, which I have seen have got good results and have given me good results when our polychrist has failed. So clinical knowledge is very important. That's what we lack, because whatever we see in 7 hours basically are the perfect cases and the perfect cures, which we try to implement in our practice but does not work. So clinically it is very important. That's why I'm just sharing my clinical experience with you. So can we go further? Lot of there today, a lot of doctors on Insta and what you call YouTube, but few questions. Questions have to be fast so that I should not get time to think. So that's also my exercise of mathematics. That I also have to recollect fast and be with you. Anybody, any other questions, so that we can always start now. Now again, I have just remembered a case. I had a wonderful case, Dr. Sangma. Oh, everybody, I had a case of hydrocele. And the patient just came to me. I had given few remedies, it had failed, but he said, sir, now he had come to me again. And what he used to do? He used to tap his scrotum like this and said, sir, I don't have any sensation. Maybe your medicines has done something, and now I cannot feel my scrotum sometimes. There was a hydrocele, and I was surprised what has happened to the patient. What has happened to the patient, and a few symptoms added, and I gave the patient a single dose of sepia. Now, can anybody tell me what is the interpretation? He used to tap his scrotum and say, doctor, you have given me some remedies. I feel the sensation has gone down on my scrotum. And I was surprised. Of course, it did not happen with the medicine, but the symptom which the patient could not tell was told now to me. When I saw this symptom, I repeatized this symptom, I gave a single dose of sepia that cured the hydrocele. Anybody who can interpret this symptom and tell me why did I give sepia? Anybody? There are few students sitting in front of me. They also want to try. So anybody, which folliculinum? Okay, I'll just tell a follicle. Dr. Ruhi, welcome. Sir, I have sent you 3 pictures of varicose vein. Can we try this case? I've not seen that case. I've not seen that WhatsApp, Dr. Sangma. I'll just go through that and tell you. But next time, remember one thing, Dr. Sangma, that homeopathy, if you take my experience, we have cured lots of cases so much, that we can't say that we can't do. Sometimes our interpretation maybe are not up to the mark. That's why we fail. But otherwise, homeopathy has given me results where I had never thought of also. That's why. Now, can anybody tell me, the patient taps his scrotum and then the hydrocele was cured. I gave a single dose of sepia. What is the interpretation which I did for sepia? Anybody? Anybody? Be fast. We are already 24 minutes. Only 5 minutes left. Otherwise, I have one more questions from Dr. Naujad about folliculinum. So we'll do that also. But first, let us see about complete this. Yes, anybody? Touching reliefs. No, the patient did not tell touching reliefs. He said, I feel there is no sensation there. And when I tap, I feel there is something. Otherwise, I can't feel that. This was the symptom of the patient. So what was the patient's, what were the symptoms of patient that you have to take care of? That is more important. Anybody? Yes? Interpretation. Yes. Which rubric? Yes, Dr. Babal. Numbness, tapping after. No. When he used to tap, then he used to feel the scrotum. Otherwise, he used to feel that there is nothing inside. He used to tap to see whether the scrotum is there or not, or there is sensation or not. So simple interpretation we did. Numbness of the scrotum, or you can say numbness of the male genitalia. That was the interpretation. There are 2 remedies which are very, very important. Of course, I know only 2 remedies. I don't know how many must be there, but 2 remedies I know. First is ambrosia and second is sepia. So numbness of the genitals, male genitals. I prescribed sepia and that cured the case. So something about folliculinum. Now, in fact, folliculinum, you have to remember folliculinum in one symptom, very, very important of folliculinum, Dr. Navjot, that is the entry point of folliculinum. Elements from domination. Yeah, I told you, no? Numbness of the genitals. Numbness. So, in order to feel whether there is some sensation, he is to tap the scrotum. Numbness, Dr. Babel. Folliculinum, one symptom, very, very important, that is elements from dominance. Second, desires for sugar and wheat. Desires for sugar and wheat. Third symptom, I have seen in many cases of folliculinum that there is dysfunctional uterine bleeding, dysmenorrhea, prolonged and heavy menses. Prolonged and heavy menses. Dr. Sajjan Santosh, welcome. Prolonged and heavy menses. Then there is dryness of vagina. There is dryness of vagina, and this I have seen in lot many of cases after menopause. The patient comes after 50 years, 60 years. There is a lot of dryness. There is a lot of burning in the vagina. This is because of some hormonal problem, and that's why the area becomes dry. Folliculinum has worked beautifully in lots of cases. Sir, what do we think of dry eczema, itching, violent occupation, diversion, amylase? No, I think Dr. What do you call Palak? I think you should be able to understand this diversion. I have told this. You have to interpret an occupation diversion. It's a very, very common thing, Occupation, diversion, ameliorates. Now, whenever you divert something, of course, there are a lot of remedies, and you must think about the remedies which I can tell you what I think about. First is sepia, second is naxomica, third is, I think, which I prescribe is calibrom, and fourth would be ferrum metallicum. These are the four remedies, very, very important, which I use in my practice. But what is the which rubric? Touching relieves? No, Dr. Babel. That was numbness of the scrotum, numbness of the male genital, and I prescribed sepia. That was a case of hydrocele. That's what we are talking about. Interpretation of that rubric. Numbness means anesthesia of that part. The patient cannot feel that, but anesthesia of the part. Okay, the rubric is numbness. Yeah, Dr. Palak, Dr. Anjali, Dr. Navjot. Yeah, thank you. So, I was just completing actually folliculinum. So, what I was telling about folliculinum. Yeah, I was telling dryness of vagina. Very, very important symptom, dryness of vagina. And of course, as it is prepared from the follicle, it ovarian follicle, so it is also important for that, what you call, fibroids. So these are the few symptoms that you must think about. And of late, I have seen few cases of post-viral syndrome. Post-viral syndrome have been given good results with folliculinum. One symptom you must remember in folliculinum that I have used in my practice: history of abuse, sexual, physiological or physical. All three are covered by folliculinum. This is the only thing which I have seen in folliculinum in my practice. So I'm just sharing with that. Does Macab work for eczema? Dr. Palak. First of all, I think you should not have asked this question, because homeopathy mein everything works if the symptom corresponds. But let me tell you that if you are thinking about Macab in relation to diversion ameliorates, I have not seen a case of Macab, because Macab, if you see a child, an orphanage feeling is there in Macab, so magnesium. So you cannot have in Macab the diversion ameliorates. Whenever you have problems, Dr. Palak, in these type of cases, one or two symptoms are very important in skin that you must think about. If there is intense itching of the skin, that means there is intense agitation, intense restlessness, intense, what you call, disharmony in the mind, that you have to take care of. And if you take that symptom for prescription, then automatically your symptoms of itching would be better. I remember a case, I think we have discussed that case, Dr. Palak, Helonius, In Helonius, there is itching so severe that the patient wants to take off the skin also. Okay. So that is Helonius. So how to handle BP case? As the name suggests, Dr. Anjali, blood pressure. So ask the patient what has increased the pressure here in the mind, and that's why the blood pressure is increased. It could be sudden, it could be gradual, it could be long lasting. So if the pressure builds up and the patient is not able to react in pressure or uh, throw his stress out of the body of the mind, the blood pressure increases, and then we have cases of blood pressure. In today's psychosyphilitic world, we do a lot of things where we are not able to get our emotions out, because everybody, we cannot believe in anybody, so we keep our emotion bottled up, and that's why blood pressure, diabetes, thyroid problems are increasing day by day. So this is a simple explanation for blood pressure. Of course, we can go on for a long time, but just ask what pressure has he increased in the mind because of emotions, and that's how you have to enter the case of blood pressure. Okay, Dr. Palak, thank you. Sensitivity decrease. So I think it's already half an hour up, and thank you everybody for joining, and thank you for spending time with me. I hope you enjoyed as much as I enjoyed sharing my knowledge with you. Thank you so much. Until next time, next Saturday, meet you on WhatsApp and Instagram. Thank you so much. Bye.